Hey, a reminder, new to this season, you can keep up with our play-by-play team on Twitter and Instagram by following at Sun Devil PBP. I'm Jeff Munn, Jordan Simone, of course, alongside. We're live at Pitchforks and Corks, Sun Devil Marketplace in Tempe. I'm going to call an audible. We're going to hold Charlie Turner-Thorne for our next segment. We have a very special guest today. Dr. Tyler Collins from the Orthopedic Clinic Association is with us. And we want to talk a little bit today. We do this every year about sports medicine, sports injuries, mostly recovery, because that's what the Orthopedic Clinic Association specializes in.
Yep.
Jeff's trying to talk too fast. Doctor, appreciate you being here.
Yeah, thanks for having me.
I think you should handle a lot of the questions because you're the guy that keeps getting hurt.
I know. I tore both my ACLs.
I never do anything, so I never get hit.
Okay. So I'm very familiar with the injuries in the game, but I just want to start it off. So a lot more talk has come about recently about sports injuries and prevention. And have you seen anything in your field as far as, prevention things that have been able to help athletes?
Sure. So by far the best thing is proper training. Good strength training, plyometrics, doing the proper workouts beforehand.
Yeah.
Not even specifically just to college athletes or elite athletes, is just kind of the normal person who wants to go out on the weekends and play basketball.
Tearing Achilles.
Right, yeah, that's exactly what I was going to say. So, you all week you sit behind the desk and don't do anything, and you go out and try to, block a shot and pop. So, so if you're just, training regularly, keeping up your nutrition, for an athlete, you're obviously doing a little bit more in terms of like explosive maneuvers.
Yeah.
But,
and you were a collegiate athlete, correct?
I was a long time ago.
What sport?
Baseball.
Okay, yeah. So
where?
You're doing.
So at Virginia.
Really?
Big time, baby.
Did you play with Mark Reynolds?
I did, actually, yeah.
Mark Reynolds, big Arizona former Diamondback.
A couple years behind me, actually.
Oh,
he
very
was younger
than
me. Yeah, he was a lot skinnier than
when he got to the big leagues, when he hit it, it stayed hit.
Right, exactly.
So, and you hit on something I think that's important to mention. We associate a lot of times that a person gets injured and they go to TOCA. But even if you're not injured, you just want to get into a training regimen where you improve your conditioning. You can go and set up a program at TOCA, right?
Sure, you can. If you're just worried about something might happen, or you go in for runs occasionally and having a little bit of pain, and you just want to make sure you're not doing more damage. That's something we can look at as well.
Yeah, because half the battle is preventative care.
Oh, that's almost all of it. If you can do the right things beforehand, you can prevent, the needing surgery or that stuff that takes a long time to recover from.
And even concussions. Then it's almost like the conversation now is, when do you put your kid in tackle football now? Because it's like the longer you can prevent, head injuries. And I started playing when I was like 6 years old, man, and just running around with a bowling ball helmet on my head. And I think like so much of it is, how long can we keep you from having this head trauma, and how much do you see in your practice of kids coming in, with concussions or symptoms like that, or even just general sports injuries at a young age?
Sure. I mean, and it's pretty common. I don't see as much head trauma just because I'm in orthopedics, but the main thing is, you start at such a young age, and we're kind of going away from this of hyper specialization where kids are only playing one sport from a very young age.
Yeah.
And especially in throwers, baseball players, overhead athletes, that can be a huge stress where I've done surgery on kids who are 12, 13 years old. Just repetitive stress of throwing. And that's where just cross-training, doing other things, becoming a well-rounded athlete prevents injuries. It's also more attractive to, I think, coaches.
I feel like the medical field has advanced enough to where, hey, if you are young and you need this surgery, it's not like it was 10 years ago where it's like you could be hurt for, a long time, or even 20 years ago. But now it's like, hey, if you get the treatment, early, you're going to be okay in the long run.
I would say yes and no. So yes, it certainly has advanced to where you can do much more minimally invasive and quicker recoveries. Humans don't heal faster now than we did 1,000 years ago. So I would say you still have to do the proper rehab and precautions and don't go back too soon, that type of stuff.
Yeah.
And sometimes that's hard in our society where you can get everything almost instantaneously.
Yeah.
That's fascinating. They don't heal as fast as they used to.
Yeah.
I've got one more question, but I promised the gang back at the station I would do this, and I'm a little late. Let's pause 10 seconds for station identification on the Sun Devil Radio Network.
KMVP FM, Phoenix, 98.7 FM, Arizona's sports station.
We're with Dr. Tyler Collins from the Orthopedic Clinic Association. I got about 30 seconds left. I know the location in Tempe. Are there others in the Valley?
Yeah, there's 3 others. So I go to one in Biltmore area near Central Phoenix. There's one in Scottsdale and one in Arrowhead, Northwest Phoenix. So we're all over the place.
Awesome. Is this your wife here?
It is.
Awesome.
Yeah.
You guys got a kid on the way here?
We do. That's our 3rd kid.
Wow.
Actually.
Oh, very good.
Congratulations, guys.
Yeah.
That's awesome.
No sleep for years.
Yeah, you're used to it, though. If it's the 3rd one, you're used to it.
Well,
hey,
thank you.
We appreciate you coming and visiting with us. We have a great relationship with the Orthopedic Clinic Association, and so thank you very much for being with us.
Thank you very much for having me.
You bet.
Thanks, Doc.
Dr. Tyler Collins with the Orthopedic Clinic Association.